Welcome to our webinar, Lupus, Dietary Factors in the Microbiome. I'm Margaret Smith. I'm the manager of the Lupus and APS Center of Excellence at Hospital for Special Surgery in New York City. And I'm joined by my panelists today and welcome you to this presentation. My colleagues today are Dr. Medha Barbaya and Dr. Randy Longman. Dr. Barbaya is an assistant attending physician in the Department of Rheumatology at Hospital for Special Surgery, and she's an assistant professor of medicine at Weill Cornell Medical College. She is focused on lupus in her practice, and her research also emphasizes looking at dietary patterns and environmental factors that might contribute to the incidence or severity of lupus. My second panelist is Dr. Randy Longman. He's an associate professor of medicine at Weill Cornell Medical College, and he's the director of the Jill Roberts Center for Inflammatory Bowel Disease and the Roberts Institute for Inflammatory Bowel Disease Research at New York Presbyterian Weill Cornell Medical Center. His research, among many things, explores how the intestinal microbiome population can contribute to inflammatory diseases, and he's also involved in the development of new tests and treatments for such conditions. So we know that for lupus patients, tummy troubles can go hand in hand with this illness. Does what we eat contribute in any way? And how can we eat to stay as healthy as possible so that we can keep medications and flares to a minimum and lead an all-around healthy life? Dr. Barbaya will be looking into those questions with us. And then Dr. Longman is going to take us on an exploration of a heretofore not really well understood environment, the microbiome. So until relatively recently, this was essentially unknown, but its secrets are gradually being given up through scientific inquiry, and we'll see how the microbiome plays a role in inflammatory disease. We have a lot to cover, and we want to have time for the questions that we will field at the end. So please input your questions as they come to you, and then we will cover them at the end of the presentation. So let's get going. Dr. Barbaya, please. Okay, let's get, very good.
Okay, so thank you so much, Margaret, and thank you to the Lupus and APS Center of Excellence for the invitation to speak here and for the kind introduction. I'm excited to talk to you today about an area that is of great interest to me in terms of my own research, but I think that is of great interest to many of the patients, at least that I speak with. So I'll be talking today about what we know in terms of the role of dietary factors in lupus. I have no relevant disclosures. And the questions I thought that we could examine today are three. And these are, related to my research, but also what I think patients have asked me the most about. And I think, there's a lot of interest in trying to better understand these. The first is diet associated with the risk of developing lupus? The second is, can diet trigger, prevent, or reduce lupus flares? And the third is this question of how can we eat to optimize our health when we're living with lupus? So just to take a step back, why even look at dietary factors in lupus? And, I think this is a bigger question of sort of why look at environmental factors in lupus. And in terms of the current thinking about how lupus develops, there's a current sort of paradigm that researchers and scientists and physicians sort of think about in terms of the way lupus develops, and this is called the two-hit hypothesis. And the idea here is that there are underlying genetic predisposition that certain patients might have as sort of the first hit, and secondly, what comes along is this environmental factor, which is hopefully, we hope, potentially modifiable, that may come along and trigger dysregulation in the underlying immune system in a patient who has the underlying genetic predisposition. And the combination of these factors may result in the development of autoimmune disease, such as lupus, and that's when patients start developing clinical manifestations and potentially start developing signs of lupus as well. So there are a number of environmental factors that have been studied and that are under investigation. And the theories to sort of expand on this two-hit hypothesis is that it's at some point in a genetically predisposed individual, even in utero or at any point in that person's lifetime, there may be an individual or the cumulative effect of a number of environmental factors, and some of them that are more well studied in lupus are listed here. I would say the strongest risk factor that we know right now is current being an active cigarette smoker, but other factors have been investigated as well and may potentially contribute to the onset of subclinical disease, which is really the development of antibodies or proteins in the body that may fight against oneself, and that may lead to the dysregulation of the immune system and the development of lupus. And the question that we're going to try to answer today is really, what is the role of diet here in developing lupus and also in patients who already have lupus? So there is some evidence regarding diet and disease. Overall, in terms of chronic disease, diet is known to affect the risk of many chronic diseases, including diabetes, cardiovascular disease, and cancer. And in thinking of our own rheumatic disease, there are a number of foods and nutrients that have been associated with different diseases. Now, rheumatoid arthritis is one of the most well-studied of our diseases, and that it's one of the most common, and there are a number of patients who have it, and so it is able to be investigated a little bit more easily than lupus. And you can see here that in rheumatoid arthritis, there are a number of individual foods and nutrients that have been associated with lower or higher rheumatoid arthritis risk. So the foods that have been associated with lower risk include dark meat fish, moderate alcohol consumption. Alcohol was thought to lower the risk of RA almost 20%, and the fish was thought to lower it almost 25%, both in moderate consumption. And then sugar-sweetened beverages have been potentially associated with a substantially increased risk of rheumatoid arthritis. And these have been shown in longitudinal studies incorporating a large number of patients. And when you think about the underlying mechanisms in terms of how diet can actually affect lupus, I think there are a number of potential mechanisms that have been proposed over the last, 30 to 40 years. And there's a theory that either sort of individually or cumulatively, there may be a dose-dependent response in terms of the accumulation of these abnormalities. And so what's thought is that there may be underlying genetic changes due to the interaction between the environment and genes that can, and that's in association with oxidative stress from the environment that can affect immune dysfunction and can affect T cells, which are a type of immune cell, can directly damage DNA and proteins, and there may be a concomitant influence by hormones, and especially estrogen-containing hormones in the development of lupus. So there are a lot of questions in terms of how lupus develops and what the role of environmental factors might be, but this slide sort of tries to summarize what some of these mechanisms might be. Now, earlier on, there was a lot of interest in this question of whether, vitamin D or other antioxidants may be associated with, preventing lupus. And so far, there's been no association found with the intake of vitamin D or antioxidants. I will mention there is a large trial underway looking at vitamin D called the VITAL study out of Boston with many thousands of patients enrolled. And I'll be curious to see the results of that trial when it's completed in a few years. So what I'll be talking about today is two recent studies that I was involved in, and these are investigating the role of various dietary patterns and the risk of developing lupus. We, in these studies, we used a very large number of patients. They were all women, they were all female nurses. The study was conducted in the Nurses' Health Study, which is a very longitudinal cohort that's been followed for a number of years, up to almost 30 years of follow-up data in patients who are otherwise young and healthy, and they were followed to see whether they would develop chronic disease of many different types. And a lot of the understanding of dietary factors in various different diseases, including cancers and cardiovascular disease, comes from data from this cohort. And so women were given these health questionnaires every 2 years, and they were very detailed. They had these special food frequency questionnaires that they were asked about every 4 years, and they were asked to recall, some of the very nuanced types of foods that they might have eaten and in what quantities over the past year. And so what we did was we collected that data, and we looked to see, of the patients that filled out that data, who went on to develop lupus, and we examined their dietary patterns over this long-term period. So we looked at the Western dietary pattern, which is a dietary pattern that's sort of a more modern dietary pattern, and includes things like refined carbohydrates and high meat, like various meat consumption and potentially high fat diets. The prudent dietary pattern is another one that's a little more towards a healthy dietary pattern, which incorporates more consumption of vegetables and fruits and various produce. And there's a lot more detail that goes into these, but just to try to summarize, we also looked at 4 other dietary scores. And I'll just briefly mention what these are. So the Alternative Healthy Eating Index is a dietary quality score that was based on the 2010 dietary guidelines for Americans. It's been associated with a number of chronic diseases. It's composed of a number of quote unquote healthy and unhealthy foods. So some examples are like fruits and vegetables, like nuts and legumes, but it's also composed of things like sugar sweetened beverages. The alternative Mediterranean diet is similar to the Mediterranean diet that many people might have heard of. It's a sort of variation on that. And it's also composed of a number of fruits and vegetables, legumes, fish, various types of fats, alcohol as well. And then the dietary approach to stop hypertension diet is represents sort of a healthy dietary pattern. It's often used to try to, in patients who might be predisposed to cardiovascular disease or hypertension, and it's based on a number of foods that are both positive, tends towards more healthy diets like low fat dairy products, nuts and legumes, vegetables, fruits. So they're all similar. They do vary in different ways. The empirical dietary inflammatory pattern is sort of this derived pattern that contains both what are thought to be potentially inflammatory food components and anti-inflammatory food components. And these were based on their association with various inflammatory biomarkers or blood levels of inflammation. So there are a number of food items that are included in this diet. So what we did was we looked at all of these sort of 6 dietary patterns in these otherwise young, healthy women, followed these women over time and tried to see who developed lupus, and did it vary depending on the types of diets that they consumed. Okay. And so what we found, for better or worse, was that there really was no association between long-term adherence to the 4 different dietary scores and indices, and with incident lupus, meaning the development of lupus, and also no association with the 2 dietary patterns, the Western and prudent that I mentioned. We did try to do some additional analyses by looking at different types of lupus. More aggressive types of lupus tend to be associated with double-stranded DNA antibodies, and we found that there were really no differences in the risk of consuming these diets and developing either of these types of lupus as well. So we did look at, in the Alternative Healthy Eating Index, which I mentioned, we looked at some individual foods to see, there's a risk in studying individual foods and nutrients because, we don't tend to consume individual foods alone. So, like for, I put up here nuts and legumes. Most people don't only eat nuts and legumes. They tend to eat in sort of a pattern. And that's why in nutritional epidemiology, we try to study diets as sort of patterns and as quality scores. But because there were, we were particularly interested in certain foods, we did try to see if there was any potential association. And we did find that in the patients who would consume the highest levels of nuts and legumes, that there was potentially a beneficial association in terms of a potential protective association for the development of lupus. We looked at polyunsaturated fatty acids, which has been of great interest in the chronic diseases, and I'll get to that in a moment. And we found that there was no benefit or harm, and similarly with fish and omega-3 fatty acids, there seemed to be no benefit or harm, thus no association. The question of alcohol comes up a lot because of the a number of studies that have shown that moderate alcohol consumption may actually be preventative in terms of certain chronic diseases. Moderate alcohol consumption has been associated with reduced cardiovascular and rheumatoid arthritis risks in longitudinal studies with incorporating a large number of patients. And previously, there had been an unclear association with lupus. So in the same cohort, the Nurses' Health Study, we separately studied alcohol, actually. So the sort of hypothesis here was that alcohol may contain sort of, various components like ethanol and antioxidants that can potentially counteract systemic inflammation. And we wanted to see if there was a protective effect of long-term moderate alcohol consumption. And moderate, really, this sort of figure on the top tries to summarize what moderate alcohol consumption might be. So for example, 1 glass of wine per night, and 1 glass of wine or 2 glasses of wine per week, for example, not per night. And so the idea there was to sort of see whether this would be sort of protective for lupus as it has been for various other diseases. And we did find that there was a potential protective effect that was significant in lupus. However, unfortunately, I don't think we can really recommend that you all go out and have a glass of wine, on a regular basis for the sole purpose of trying to prevent the onset of lupus, largely because alcohol is complicated. And I think, the biggest concern right now is that the American Cancer Society recently reversed its recommendation regarding alcohol consumption and recently recommended avoiding alcohol due to the potential increased risk for various cancers, especially things like breast cancer. And so, I think at this point, while it's interesting and alcohol may have certain components that relate to diet, at this point, I don't think that we would recommend increasing one's alcohol consumption for the purpose of being protective against these chronic diseases such as rheumatoid arthritis and lupus. Okay, so I mentioned omega-3 fatty acids, and I wanted to sort of segue here. There's very little data known about dietary factors in terms of the reduction or prevention of lupus flares, and unfortunately, it's a tough area to study. It does require a lot of patient involvement, and I hope that over time we're able to really expand the studies looking at the role of diet and lupus flares. And there have been a number of trials that have tried to see whether omega-3 fatty acids, which is the component included in fish oil, for example, does it help reduce lupus flares? And I will just mention, I've listed a few trials here that have been completed, and I'll just mention that you can sort of see these incorporated not very many patients, and they were done over either a 12-week period or a 24-week period, so also not extremely long term. But the ones that were done, 3 of the 4 of them really showed that there might be some significant improvement in lupus disease activity and potentially in the functioning of various immune cells, and might actually improve circulating inflammation. So there is a potential role for omega-3 fatty acids. The VITAL study that I mentioned earlier regarding the role of vitamin D is actually also investigating the role of omega-3 fatty acids in a very large number of patients, I think close to 30,000 patients. So I think we're very interested to see the results of that trial as well in terms of this question. Okay, so we get this question a lot, and how should I as a patient manage my diet with lupus? And I think it's a great question. I think it's an extremely important question. If we can modify our own risk factors in terms of preventing disease or preventing worsening or flare-ups of our disease, that would be amazing. And that's really what's driven me to look into this area as an area of research. How can we modify our own risk? Unfortunately, though, as I've mentioned, there really hasn't been any sort of definitive answers in terms of what the role of diet is in preventing lupus or even causing lupus, or preventing its worsening. So I will say, this is just a picture of, like, if you Google lupus and diet, many theories and books and lectures and articles pop up on what you should eat and what you shouldn't eat. And I just want to mention that we really should be aware of misinformation, because I've seen it before, and I've heard of patients really sort of going to extremes in their dietary changes because of some of the information that's out there. And we just want to make sure that any dietary changes that you make should really not delay any necessary treatments that are being recommended by your physician. I cannot emphasize that enough. And it should be, if there are dietary changes, it should be discussed with your physician, your nutritionist, your team, so that there's an understanding of what's being done, and those individuals can also weigh in. So I thought we would just briefly mention how I approach this conversation with patients and how I think about it. And I think it's important to first look at your own sort of health picture as an individual. It's important to examine underlying nutritional deficiencies and replete those as needed, because that can, these can often coincide with chronic diseases. Medications definitely can play a role here, and steroids, for example, corticosteroids like prednisone and Medrol and others that we use to manage our disease can certainly contribute to diabetes and osteoporosis, and the role of diet and exercise cannot be overemphasized in trying to help ward off some of these factors as well. Your life stage, the dietary recommendations might be different for women who are childbearing, those who are postmenopausal, so it is important to consider these as well. Physical activity, as well, it can be extremely important in managing one's disease and feeling well. And then smoking, as I mentioned, smoking has been one of the major environmental risk factors that's been demonstrated repeatedly in a number of epidemiologic studies as potentially being associated with our rheumatic diseases, including lupus. You should also consider your risk for other common comorbidities of lupus. Cardiovascular disease is highly associated with lupus. It's one of the leading causes of death in lupus. And so, tailoring one's diet to preventing cardiovascular disease and having a heart healthy diet is key. Similarly, high blood pressure, kidney disease, as we know, and diabetes and osteoporosis are also associated with either the disease or sometimes the treatments that we use to get the disease under control. And as I mentioned, there are, lupus patients may be at increased risk of cardiovascular disease and cardiovascular death. So it's important to manage that component when thinking about diet and exercise as well. So in terms of just how to think about this in terms of granularly, I think we really sort of use the guidelines, the dietary guidelines that are published when I recommend for patients how to optimize their health and including their comorbidities. And I think it's important to consider, a patient's culture, their preferences, various food sensitivities that they might have, even though food sensitivities haven't really been shown to be clearly associated with lupus in particular, and also the budget, and that's an extremely important factor. So, the current guidelines that have been published this year, listed below, really emphasize eating more fruits and vegetables, whole grains, legumes, and nuts, which, as I mentioned, may potentially be associated with lupus, preventing lupus, seafood, other kinds of, healthier meats, unsaturated oils, and low or non-fat dairy. So, while there's not clear evidence, these items are thought to, be heart healthy and to optimize one's overall health. The foods that have been de-emphasized overall are red and processed meats, sugar-sweetened beverages, which I mentioned has been significantly associated with an increased risk of rheumatoid arthritis, saturated fats, refined grains, and high sodium foods. So this is sort of a summary slide on how one can sort of optimize one's health in the constraints of having the diagnosis and the medications that we use, and in taking into consideration the comorbidities that can develop with lupus. So I'll end here. Thank you again for your attention. And I just want to acknowledge the funding source for a lot of the research that I've presented today, which is the Rheumatology Research Foundation. And many thanks to the many patients and collaborators who were involved in this research. So thank you again.
Thank you so much, Dr. Barbaya. That was really enlightening. And now to take us to our next topic, Dr. Longman, please.
Okay. Can you see my screen, Margaret?
Yes.
Okay, super. Well, thank you. And also thank you to the foundation and Margaret for really organizing this wonderful program. I think it's sort of like a conceptual complement to the wonderful presentation that we just heard. I wanted us to consider the microbiome, the intestinal bacteria, and its potential, contribution to lupus, and its potential interaction, with the diet, as we just very elegantly heard. These are my disclosures, which are not relevant for today, but I guess the one major disclosure is that I'm a gastroenterologist and not a rheumatologist. When most of us think about bacteria, I think we think of this, really, germs, and thinking about bacteria as bad things, and if your kids are like my kids, when they go out, to the street and into the bathrooms, they always touch the dirtiest things, but germs are not, always bad. And what I wanted to sort of, highlight is that the microbiome, as we think about that as a composite of bacteria, has good bacteria and bad bacteria. And these are some characteristics of those good bacteria that can either be symbiotic, where they live in an interdependent way. They help us, we help them. Commensals that also sort of coexist, right? We don't benefit from them, but we coexist, in a peaceful way. And those two things, symbiotic and commensal relationships, are critical for establishing that ecosystem that coats our body. And of course, there's pathogenic bacteria that can be sort of disease causing. And these microbiome communities, these microbial organs, as I would call them, are found in many different places on your body, on the skin, in your intestinal tract, and at your different mucous membranes. I think that the intestinal microbiome really plays a central role, and that's kind of, illustrated here. Hopefully you can see my pointer, Margaret, if you can.
Yes, we can.
Are you seeing the presenter view, or are you seeing the actual slides?
We're seeing your main slide and then the one that is to come. So if you want to, get to.
Is that better?
Yes, definitely. That's
okay.
much better. Thank you.
Okay, very good. Sorry. Okay, so perfect. So the intestinal microbiome is really at the center of what we kind of just heard, about the dietary nutritional factors, and then also, idea of probiotics, of bacteria that help support this intestinal microbiome. But what I will argue is that this intestinal microbiome, these gut bacteria, play a critical role in our health and sort of the integration of what we just heard about, of specifically what you're feeding the microbiome and what you're putting into the intestinal and GI tract. The microbiome plays a critical role in nutrition, both in synthesis of vitamins, of bile acids, of different nutrients that we need, but also in the absorption of them as well. The microbiome plays a critical role in metabolism. It's not just about what we absorb and how our body metabolizes different nutrients, but it's also how the bacteria eat and what they provide for us. And then lastly, the bacteria play a critical role in regulating how our immune system works, and that's critical when we think about lupus. So the microbiome plays a really big role in both health and disease. In healthy states, the microbiome plays a key role, as we just discussed, in mucosal protection, nutrient extraction, and metabolism. In diet, as we heard, is a regulator of lupus, also is a key regulator of the stability and variability of the microbiome. In situations of disease, particularly inflammatory disease, such as lupus, rheumatoid arthritis, inflammatory bowel disease, but also metabolic disease, such as obesity, the microbiome can be altered. One note I also just wanted to make is, we focus on bacteria, but there's other microbes as well that live both in the intestinal microbiome, but also on our body. And these include viruses, fungi, parasites. And again, they're not always bad, but that we interact with them and they function and provide a service in terms of our health. And so I like this cartoon from the Human Microbiome Project, suggesting that there are genetic signatures of disease-causing bacteria lurking in everyone's microbiome. They live peacefully among their neighbors, and half of your stool is not leftover food, but is actual microbial biomass. So thinking about the stool and the microbial organ as a functional property. So how can this be real, right? I mean, how can this be that the gut bacteria are truly, playing a functional role? Well, I think it's important to think that the microbiome is actually bigger than us. Intestinal bacteria that are colonizing your body and your surfaces outnumber your human cells by 10 to 1. The genomic material of these bacteria contain more than 300 times the number of genes compared to the human genome. So there's a huge genomic contribution, and there's a huge metabolic contribution to what these bacteria are doing. So what are they doing? What are these common genes? What are the common functionalities of the microbiome? And one of the main things that we see in a lot of research that's been done is that they're really working on metabolism. They're focused on metabolizing carbohydrates and sugars and different things that we eat, essentially. Culture, geography are major factors that regulate the microbiome. And this is likely due to diet, as we see in more agrarian societies, in Malawi or Mara Indians. This is a graphic representation. This is a graphic representation of the composition of the microbiome. And you can tell that the orange and the purple is mostly there in agrarian societies. But when we switch over to Western societies, and this is particularly St. Louis in the United States, we switch over to the brown, and this is a different type of bacteria. So the type of bacteria that we have is regulated by our culture, our geography, and particularly our diet. It's important to note that that the microbiome behaves differently across the lifespan. And one point that I want to illustrate here is that the microbiome can change over the lifespan. It's changeable and adaptable to what we are eating at that time. If you take, for example, babies that are formula fed, the bacteria in the gut switches its metabolic profile so that it can extract certain nutrients that are provided in the highly enriched formula. However, breastfed babies switch their metabolism so that the microbes are actually synthesizing the vitamins and the nutrients that are not present in breast milk. So the microbiome is a microbial organ, but it's also adaptable. It's changeable so that it can provide the right nutrients that we need depending on the context, depending on the diet, depending on the environment. And so we have to consider the microbiota when looking at nutritional needs across the lifespan. And I think that's also very important to consider in the context of the first presentation, because some of the effect size that you would anticipate to see from some of the nutritional interventions, you may not see as robustly, but that may be because the microbiome is also shifting to accommodate for that. So diet, and I've alluded to this, but diet is a critical factor in regulating the composition of the microbiome, in regulating what bacteria are there and what are they doing. And this, is some text here describing a particular study in which individuals were switched to either a plant-based diet or an animal-based diet. And within 5 to 7 days, you could already see changes in the composition of the microbiome and the functionality of that microbiome. So again, even in the adult situation, that microbiome is changeable, is adaptable, so that it can extract the nutrients in the way that we need it to. I like this, picture. What are they feeding your food? And, it's been a long-term practice in the cattle industry to give subtherapeutic antibiotics to cattle because it helps them grow bigger for some reason. And we actually don't really fully understand that. But the idea there, again, is that it's shifting the microbiome to change metabolism, and that it it essentially creates metabolic disease in some of these cattle to make them bigger. And this is a cartoon from a group at NYU who very nicely demonstrated this in a mouse model, that if during early life mice are exposed to low-dose penicillin, it changes the early life protective bacteria and can lead to obesity. And if you take those bacteria in that obese mouse and then transfer it to another mouse, then that other mouse becomes obese. So there is a window period in development in which a microbiome is critical for establishing a set point, establishing a baseline of your microbiome that tells your body where metabolism should be, where your body fat composition and nutrient needs are. I wanted to highlight that it's not just about what bacteria are there, but it's also really about what they're making, right? So I've alluded to the fact that the bacteria eat the food that we eat, and they create byproducts of this different food. And one of them, in response to fermentable dietary fiber, is something called short-chain fatty acids. And we know, at least at the intestinal barrier, right, at the area of interface between your gut and the mucosal lining, short-chain fatty acids play a critical role in helping the health of that intestinal barrier. And this is just a histologic slide showing exactly that. The higher the short-chain fatty acids are, the better health and better integrity of that mucous membrane, of that barrier. So then how do these bacteria then contribute to inflammatory disease? And obviously, we're particularly interested in lupus. And so I have a summary cartoon here that goes through some of the mechanisms by which these bacteria at the gut interface could contribute to the underlying mechanisms that we see in lupus. And I'm going to go through this kind of slowly here because I think it's a really important slide. Well, on the first side over here, hopefully we can see my pointer, under health, you have different bacteria here at the mucous membrane. These are epithelial cells at the gut interface. And what is trying to be illustrated here is that the immune system is sensing these bacteria, and they can activate immune cells called B cells. B cells are the cells that make antibodies, and in these antibody repertoires are critical in our immune response, but are also changed in the pathogenesis of lupus. So how do these bacteria interact with the immune system in both health, but then also what goes wrong in autoimmune diseases? And so if we look on the right-hand side, this is under potential mechanisms that may contribute to lupus. One, there's something called a restricted gut microbiota diversity. What does that mean? That means that the diverse universe of bacteria that you have in the gut are now much more limited. You have a few more, less bacteria, less diverse bacteria in expansion or bloom of what we call pathobionts, of bacteria that have the potential for being pathogenic. And how would that happen? So there have been reports about certain bacteria that are illustrated here that they can actually get across the barrier, that they can translocate or move across, and then they can directly activate immune cells, in this case called Th17 cells, or different T cells that are able to produce either cytokines or B cells that can create autoantibodies. There's also different bacteria that have been shown to trigger what we call adaptive responses. Again, these are B cell and T cell activation. And one idea here is that these B cells or T cells are responding to a particular antigen that then cross-reacts and then mimics something that your body sees in itself, and that can lead to autoimmune disease. In some of my final slides here, I wanted to talk about, so what do we do about this? how can we change the microbiome? Can we regulate it in terms of therapy? Well, one idea that's emerging in several fields of inflammatory disease is something called fecal microbiota transfer, or FMT. This is the process of transferring a healthy microbiome to a person with certain types of diseases. Now, this has been used very effectively for intestinal infection, particularly C. difficile colitis, and it's under investigation for many different diseases, metabolic disease, but also inflammatory bowel disease. And then illustrated over here in the cartoon is very similar to the mouse models that we talked about, is if you can take a microbiome, a microbial organ from someone who is obese, transfer that into a mouse in this case, and recapitulate that phenotype, now be sufficient to allow to the induction of obesity, can we then do the opposite and take the microbiome from a lean person, from someone with metabolic homeostasis, and transfer that to a recipient, and then allow that to generate a lean phenotype? And if we can transfer that phenotype, can we also transfer or prevent inflammatory disease? So I think it has, some really exciting implications, for microbiome science that are still emerging. I think that, very nicely, as we heard from the first talk, there needs to be, more research into understanding how specific diets can impact the microbiome, and to modify the therapeutic efficacy of these medicines and these medical approaches. Fecal transplant is one of those, and it's definitely under investigation. I think that also, if we have better diagnostics for either understanding, who is going to respond more precisely to dietary intervention, or using it, prognostically to understand how patients might benefit from different therapies. So, with that, I'd like to thank you and thank the Foundation again for organizing this excellent seminar. I'm happy to take questions.
Thank you so much, Dr. Longman, and thank you, Dr. Barbaya. Okay, so we do have quite a few questions. I'm going to start us with some that dovetail with Dr. Longman's presentation. So a lot of people want to know, does taking a probiotic help?
So there are certain situations, in which, taking a probiotic helps. There are certain, intestinal infections. There are certain inflammatory diseases, in which dysbiosis is established, that probiotics can help. To my knowledge, unfortunately, this hasn't been studied, rigorously in lupus. But I would defer to others, with respect to specific studies of probiotics in lupus.
Okay, all right. Somebody was asking a question about small intestinal bacterial overgrowth, SIBO, and can that be related to lupus?
So I can start, and then maybe Dr. Barbaya can comment on the link with lupus. Small intestinal bacterial overgrowth is exactly as it sounds. This is the outgrowth of bacteria in the small intestine. Usually the small intestine has a very low load of bacteria, and the colon, the large intestine, has the higher load of bacteria, but sometimes the bacteria can move higher up. And the problem with that is that when you eat, the bacteria also eat. And what happens is the bacteria eat, they create gases, fermentable gases that can then cause bloating, and then they shuttle forward osmotically active substrates, which pull water in and then can cause, diarrhea. So, folks with small intestinal bacterial overgrowth can frequently have bloating, abdominal pain, and diarrhea and urgency, associated with that. Now, the issue is sort of what causes small intestinal bacterial overgrowth. in inflammatory bowel disease, if you have an obstruction, a stricture, inflammation, in the bowel, which prevents the migration of stool, of bacteria normally, through the colon, that can cause a backup. And so now you have this growth of bacteria. Other times, if you take a course of antibiotics, or, if there's an infection or something that can cause dysbiosis, it can leave the person with an outgrowth of bacteria more proximally higher up in the intestine. These certainly are a problem. I'll turn it over to Dr. Barbaya to maybe know whether or not there's the association of SIBO with lupus.
Yeah, and I think it's a good question. It's an area that's under investigation. To summarize, I think that lupus has been, as you've heard from the great talk from Dr. Longman, that lupus, potentially has been associated with imbalances in the gut microbiome. And there have been some recent studies suggesting that there are, in some patients, sort of bacterial imbalances may drive lupus and may be associated with disease flares. But I think it's still an area under investigation, and we don't know definitively yet.
Thank you. Okay. So, Dr. Longman, how would you know if you have a restricted microbiota in the gut? How would this manifest?
Well, no, I mean, unfortunately, you wouldn't really know. I mean, there's no CLIA certified, which means like clinically verified, diagnostics that your doctor can come to you and say, aha, this is kind of, what's going on. But, that being said, what we do know is that the restricted microbiota frequently comes with inflammatory disease, right? So if your inflammatory bowel disease is active, if your lupus is active, if your RA may be in some cases, although RA may be less associated with that. But when disease is active, the microbial organ is also reflective of that. And so, the underlying idea here is that we have to get better control of disease. So, within lupus, within inflammatory bowel disease, the idea is to get effective therapy that we're treating the whole body, and the microbial organ will be treated at the same time. We currently don't clinically, look at the microbial organ, microbial dysbiosis, as a separate test, right? So if your lupus is under great control, it is not clear to us that we need to treat microbial dysbiosis as an independent factor. Does that make sense? So the big picture here is making sure that the inflammatory disease is under control. I'll turn it over to Dr. Barbaya for specifics.
I agree.
Right. Okay. So then the question from one of our listeners is, what foods do you recommend to help the microbiome? Either one.
Well, so I'll just start. I mean, I would just say, that I think the preponderance of data suggests that the microbiome, is responsive to these foods, and I think that the data that Dr. Barbaya presented, is likely modulating exactly these factors. Unfortunately, the data are just still in the infancy to understand exactly, what bacteria we're looking for and how to, use those metabolomics to trace that. But I think the key tenets that we discussed in the first presentation still hold. So Dr. Barbaya, maybe you want to go over some of those.
Yeah, and I can review. That's great. I think that's a nice summary, and the data really is still in its infancy. But I think what many studies that have been done so far at least suggest is trying to, as I mentioned, overall optimize one's health, and really sort of adhering to some of the guidelines that give sort of a list of foods that emphasize as the healthier foods being sort of fruits and vegetables, whole grains, legumes, nuts, various types of healthy meats like seafood and lean meat and poultry. And then additionally avoiding, foods like high fat dairy foods or, whereas low fat or non-fat dairy may be healthier, and unsaturated vegetable oils. Now, how these all relate to the microbiome and whether these foods in particular directly modulate all of the effects that you've just heard about is still under investigation. But these are thought to be the foods that, can help optimize one's health through various mechanisms, as I mentioned, cardiovascularly, and just in various other ways as well.
Great. A lot of people want to know about gluten-free diets, and is that helpful in inflammatory disease?
So I can just start by saying there that, I think if you have celiac disease, and Dr. Longman can jump in, but I think if you have celiac disease, a gluten-free diet is thought to be critical. And we get this question a lot in our rheumatic diseases, but there really isn't any other great evidence in terms of whether gluten worsens or improves inflammation in our rheumatic diseases such as lupus. And so I think if you've been tested for celiac disease and been shown to have it, it can really have benefit. Now, I have some patients who anecdotally will come to me and tell me that, they tried to go on a gluten-free diet and various manifestations of their disease have improved. And, I think it's not easy to be on a gluten-free diet. I think that if, as a patient, if you want to try it and you're still getting all of your sort of nutritional, your full nutritional benefit from your diet, and it's not an extreme for you, there may be some value in trying it, but there really isn't data at this point, at least. There isn't evidence to suggest that it will improve or prevent lupus.
Okay. And people also ask about dairy. So eating dairy-free diets, is that similar?
Not enough data to really comment on that similarly, but if, again, similar recommendation that I give to patients is, try it as long as you're getting your calcium sources and you're getting your full nutritional benefit from various means. It's reasonable to try these things and see if they help in the absence of data, really.
Right. What about someone who's got kidney disease or lupus nephritis? Do you have a recommended dietary pattern or things to avoid, emphasize in order to try as best as possible to keep that under control?
Yeah, it's a good question. And I think, it's important for patients who have chronic kidney disease to incorporate nutrition into their lifestyle, and they potentially may need to alter what they eat to manage chronic kidney disease overall. I would say lupus patients have other, as I mentioned, there are other comorbidities that sometimes go along with kidney disease and other treatments that we use, like steroids, et cetera, that have their own issues in terms of diet and lifestyle and exercise that need to go along with that. But I would say there are a number of things that patients who have lupus nephritis or kidney disease from their lupus could consider. The first is, the biggest one is to really choose foods that are, or prepare foods that are, have less sodium or salt in the diet. And this has been shown to sort of help control blood pressure and, has various cardiovascular benefits in patients with kidney disease. There's been some data suggesting that eating the right amount of protein and the right types of protein is important to help protect one's kidneys. The kidneys are, when your body uses protein, the kidneys are what sort of eliminates the protein and produce waste. So it's important to adjust that as well. I think, as I mentioned, cardiovascular disease can go along with chronic kidney disease. And so it's important to choose foods that are thought to be heart healthy. And there are a number of guidelines that exist along this vein, and the goal is to try to keep fat from sort of building up in one's blood vessels, in the heart, and in the kidneys, et cetera. And various heart healthy foods are things that I've already mentioned in the guidelines that I showed earlier, things like beans and vegetables and legumes and omega-3, et cetera. And then I think the last thing is, in patients with kidney disease, we often advise them to choose foods that are, have less phosphorus, which can sometimes build up in one's blood in patients who have severe kidney disease. And so, I think most of our patients who have kidney disease sort of work with us in collaboration with a kidney specialist or a nephrologist, and often do have a consultation with a dietitian, which I think is very helpful. But, there are I think beyond that, in terms of lupus nephritis, there are no specific recommendations except, for patients overall who have chronic kidney disease.
Right. People ask about herbal supplements. Are there any that can help with the reduction of chronic inflammation?
I can try to sort of, I mean, I think there's a lot of interest in sort of herbal supplements and alternative treatments for autoimmune diseases in general, including lupus. And, you know, I think so far there really isn't any clear evidence of a benefit for these proposed treatments and therapies. You know, as I mentioned, there's a large study looking at fish oil that, you know, could potentially, that's been, as I mentioned, preliminarily shown to be beneficial in lupus patients, but really, you know, more study is still needed for the fish oil question. So we aren't sort of prescribing it for our lupus patients. I've heard of a number of other patients tell me that they're taking things like turmeric and, you know, like elderberry and other sort of herbal supplements. And at this point, there really isn't data supporting the use of those medications. And I would say, you know, really like discuss the use of those medications and be forthcoming with the use of those medications with your physician. They should know about them. If you are, I mean, of those therapies, if you are using alternative therapies, because at this point there's no clear link, and using these therapies in very high doses may actually be detrimental. So it's important to be cautious with the use of herbal therapies.
Okay, we're getting to the end here. I think here is, I think, a good question to ask as we close out. So are there any near on the horizon biologics that are promising in the treatment of this crossover with lupus and bowel diseases or inflammatory conditions that affect the intestines? Maybe Dr. Longman, can you respond on
Sure.
that?
You know, again, I'll go back to my disclosure in saying that I'm not a rheumatologist, but, you know, within inflammatory bowel disease, it's really exciting, you know, all the different medicines and pathways, you know, that are now specifically being targeted. Within our field, you know, we started with a few molecules, you know, TNF alpha, you know, and have now expanded to IL-12, IL-23, specific molecules called JAK inhibitors, which are pills that people are taking for inflammatory bowel disease. Understanding different trafficking molecules, how to block T cell trafficking that we can specifically do, different types of molecules that are stimulating T cells. It's really becoming very intricate. And in the field of inflammatory bowel disease, we are trying to understand that. One thing that I think is really interesting, you know, as we think about the link between the gut and you know, systemic autoimmunity and inflammatory disease is what specific pathways are those, and how do we use these medicines, you know, more selectively for someone who has gut inflammation and systemic inflammation? Is there a particular pathway now to identify from those types of diagnostics? Right now, unfortunately, it's still anecdotal, right? I have patients who have overlap between inflammatory bowel disease and lupus. You know, and unfortunately, it's just anecdotal as we shop through these medicines. But you know, the goal is in sort of the studies that we're doing now, as all of you, you know, participate in these studies when you come, you know, to our center, is to understand exactly who's responding to which medicine and why. And, you know, how we can analyze your blood cells, your stool sample, you know, exactly things about you that are now going to teach us how we should use these medicines in a smarter way in the future. But it's really, it's a very exciting time. It's a very daunting time, you know, to be both a physician and a patient when you have this whole laundry list of medicines and trying to figure out which one is right for you. But it's a very exciting time, and there's a lot of potential. I'll turn it to Dr. Barbaya for maybe some specific meds if she wants to highlight.
Yeah, no, I agree with everything you said. I think it is, as a patient, it can be very daunting, especially to try to navigate all of this data and to try to figure out the best treatment options. And, you know, the fact that there is sort of not clear definitive data in a number of different dietary factors and components. And I think it is an exciting time as sort of on the scientist physician side, because of all of the biologics that are underway and the sort of the treatment options that are being considered, and the studies that are being done to better understand the mechanisms. So I would just echo that and say that at this point, there aren't clear specific treatments that I would discuss further, beyond just saying that hopefully soon, in the coming months and years, we'll have more information to share.
Great, thank you. Thank you both, Dr. Longman and Dr. Barbaya, for your participation today. It's been invaluable. I believe the audience would feel the same way. And I thank our audience for being with us today. You give us the reason for being. Please remember to complete your survey that should appear in a new window as soon as you leave this webinar. And the recording of this program should be posted in about 3 weeks or so. I will send an email telling you that, giving you the link to that, the slides, summarizing the main points, and also listing out some of the references so that you can keep that. We've got a lot of resources online for our lupus patients. A lot of educational articles. So I encourage you to come and romp through our website. It's hss.edu/lupus center. And we love to hear from you. So if you'd like to drop us an email, you can do so at lupusapscenter@hss.edu. Thank you for joining us today. We hope that you'll come see us again for another webinar. And in the meantime, please stay healthy and safe.